Coming to the structure of insulin, it consists of two chains alpha and beta connected by two disulfide bonds and a third disulfide bridge on a chain. Alpha has 21 amino acids and beta has 30 amino acids, total of 51 amino acids. Synthesis and excretion of insulin. Insulin is synthesized by ribosomes on endoplasmic reticulum in the form of proinsulin, and it is then transported to the Golgi apparatus to form insulin. Here, the formation of insulin continues within the storage granules, which therefore contain proinsulin, insulin, and C-peptide. These granules move to the cell wall and their membranes fuse with membrane of the cell, expelling the insulin to the exterior by exocytosis. Insulin is formed after detaching connecting peptide, that is peptide C, before secretion. The process of release of insulin requires ATP, cyclic AMP, and presence of calcium and potassium. The normal fasting insulin concentration is around 10 to 15 units per ml. Transport and distribution of insulin binds with the circulating plasma protein of anti-insulin activity called as syn-albumin. Insulin fixes to insulin receptors, that is a glycoprotein in nature, on the cell membrane and mini tissues. Insulin exerts its effects without entering the cell on which it acts. If you see metabolism, half-life of insulin is about 5 minutes. 80% gets metabolized by the liver and kidneys by hepatic glutathione and insulin dehydrogenase, which breaks the disulfide bridge to SH groups with the separation of alpha and beta chains. 20% in rest of the body tissues, and it is destroyed by insulin protease. Actions. The actions of insulin on the cell permeability: it promotes the glucose entry into the cell except for the RBC, liver, and in brain cells. And if you see the effect on metabolism, on carbohydrate metabolism, it increases the peripheral utilization of the glucose, and it increases the uptake of carbohydrates by liver cells. And insulin is responsible for stimulation of glucose transporters, which are called as GLUTs. Stimulates phosphorylation of glucose by stimulating glucokinase, and it activates glycogen synthetase and helps glycogen synthesis in liver and muscle. It also inhibits glycogenolysis and gluconeogenesis. It inhibits the secretion of glucagons. In hyperinsulinemia, patients suffer from hypoglycemia because of the decrease in the blood sugar. Brain cells are affected and produce convulsions. In insulin dysfunction, glucose utilization is severely affected. You see its effects on protein metabolism. Its action is totally anabolic. It facilitates the transport of amino acids into the cell from blood by increasing the permeability of the cell membrane. It accelerates the protein synthesis by influencing translation of mRNA. It is going to inhibit gluconeogenesis, thus decrease protein breakdown, and it can promote the growth. It acts synergistically with growth hormone. Its effect on fat metabolism: it promotes fat synthesis by increasing the transport of glucose into liver cells, and this glucose is utilized for the synthesis of fatty acids and triglycerides. Acetyl-CoA carboxylase is activated, that is the enzyme which is required for fatty acid synthesis, by insulin. Insulin increases the deposition of triglycerides by breaking down the circulating triglycerides by lipoprotein lipase. It promotes the storage of fats by inhibiting the action of lipases. Some of the other actions of insulin are: insulin increases urea output from the liver and increases the uptake of potassium and phosphate. Insulin increases the potassium entry into the cell by decreasing extracellular potassium. It also activates ATPase activity, thus increases the potassium entry in the cell. Glucose transporters. Glucose enters the cell by facilitated diffusion. But in the intestine and kidneys, glucose entry is by secondary active transport with sodium. In muscle, fat, and other tissues, insulin facilitates glucose entry into the cell by increasing the number of glucose transporters. There are 14 varieties or isomers of glucose transporters, that is GLUT, GLUT. Glucose entry in the cells of muscle and adipose tissue is dependent on GLUT4. GLUT4 is insulin dependent, that is, insulin is required for its activity. Normally, GLUT4 is present in the cytoplasm of the muscle and adipose tissue cell, but in presence of insulin, GLUT4 are translocated in the cell membrane. GLUT is a sort of channel protein, that is, it contains channel within it. Normally, glucose cannot cross the cell membrane, but when GLUT4 is present, the cell membrane contains a channel through which glucose enters from the extracellular fluid into cytoplasm. As cytoplasmic glucose is speedily metabolized, the ECF glucose concentration remains higher than the glucose concentration in the cytoplasm, and glucose entry occurs due to the concentration gradient. Insulin receptor substrates facilitate the translocation of GLUT4 from cytoplasm to the membrane. Coming to the regulation of insulin secretion. Secretion of insulin is mainly regulated by blood glucose levels. In addition to other factors like amino acids, fat derivatives, hormones, autonomic nerves, also they regulate the insulin secretion. Coming to substrate control, blood glucose. Blood glucose stimulates insulin secretion. Note that sugars like 2-deoxyglucose, monoheptulose decreases the secretion. Whereas amino acids like arginine and lysine, they are most potent stimulators of insulin, and certain other amino acids also they stimulate. Fatty derivatives like beta keto acids they stimulate insulin secretion. Cyclic AMP and various other cyclic AMP generating substances like the stimuli that increases cyclic AMP levels in beta cells increase insulin secretion by increasing intracellular calcium levels. Autonomic nerves, stimulation of sympathetic nerves to the pancreas inhibit its secretion via alpha adrenergic receptors, where the neurotransmitter produced will be norepinephrine. Whereas parasympathetic stimulation increases the secretion via M4 receptors, where the neurotransmitter involved is acetylcholine. Gastrointestinal hormones like glucagon, secretin, gastrin, CCK, GIP stimulates insulin production. Hormones like glucagon, growth hormone, cortisol stimulates, and insulin somatostatin inhibits secretion. Potassium depletion decreases the insulin secretion, whereas drugs like sulfonylureas, which are used as anti-diabetic drugs, stimulate, and diazoxide, which is used as antihypertensives, thiazides, phenytoin, aloxone decreases the